Have you ever brushed off a weird symptom because it just didn't seem serious? Maybe you felt a little more tired than usual. Or you woke up in the middle of the night with a strange feeling in your chest. Maybe your back ached. Or your jaw felt tight. But you told yourself, it's probably just stress or age. But what if it wasn't? What if that small silent symptom was actually your heart crying out for help? Here's the truth most people don't know. 1 in 5 heart attacks in the US happen with no obvious signs. No chest pain, no dramatic collapse. Just quiet, subtle signals that are often mistaken for something else. Especially in seniors. At Senior Health Tips, we've heard too many stories from viewers who lost a friend, a sibling, even a spouse, not because they ignored a heart attack, but because they didn't even know one was happening. That's what makes silent heart attacks so dangerous. As we age, our bodies speak to us differently. Pain isn't always sharp. Fatigue can hide something more serious. A bit of nausea or a restless night. It could be nothing, or it could be everything. That's why this video might be one of the most important ones you watch this year. We're gonna walk you through 7 silent signs of a heart attack that older adults often overlook. And yes, number 3 is the one even many doctors admit they miss far too often. If you're over 60 or care for someone who is, this isn't just another health tip. This is life-saving knowledge. So grab a cup of tea, settle in, and stay with us. What you learn in the next few minutes could make all the difference for you or someone you love. Let's get into it. For decades, the classic image of a heart attack has been the same. A sudden, crushing pain in the chest, a dramatic collapse, and immediate, undeniable distress. But for millions of older adults, that image is dangerously misleading. The reality is that many seniors experience heart attacks without any of the textbook warning signs. No sharp chest pain, no intense pressure, no moment of clarity that something is wrong. Instead, the symptoms are often quiet, vague, and easy to dismiss, especially when aging bodies are already dealing with other daily discomforts. So why do heart attacks in seniors present so differently? The answer lies deep within the body's aging systems. As people get older, the nerves that carry pain signals become less sensitive. This means that what might cause searing pain in a 30-year-old may register only as a dull discomfort or nothing at all. In someone over 70, age-related nerve degeneration, common in the elderly, plays a key role in muting the body's natural alarm system. On top of that, many seniors live with chronic health conditions that can blur or mask the early signs of a heart problem. Conditions like diabetes, for example, are known to cause nerve damage that blocks pain signals from ever reaching the brain. This phenomenon is one of the reasons diabetics often suffer what doctors call a silent heart attack, an infarction without pain. It doesn't stop there. Seniors are also more likely to attribute symptoms like fatigue, shortness of breath, or mild discomfort to other causes. After all, when someone experiences joint stiffness, back pain, or sleep issues on a regular basis, it's easy to assume that a new ache or wave of tiredness is just part of getting older. But therein lies the danger. When the warning signs of a heart attack mimic common signs of aging, or other conditions like arthritis, indigestion, or anxiety, they're far more likely to be dismissed or overlooked. Younger individuals tend to have more acute, localized symptoms that prompt immediate concern. A 40-year-old feeling a stabbing pain in the chest might rush to the ER without hesitation. But a 75-year-old feeling exhausted after climbing stairs may simply rest and assume it's due to aging or lack of sleep. The threshold for alarm is different, not because the heart is less at risk, but because the signals are less dramatic. This subtlety is especially concerning given the stakes. With each minute that passes during a heart attack, more heart muscle is damaged, potentially leading to permanent disability or death. Yet, because the symptoms in older adults can be mistaken for everyday discomforts, precious time is often lost. Studies have shown that seniors are significantly more likely to delay seeking medical help during a heart attack compared to younger adults. The longer the wait, the worse the outcome. Even more alarming, some heart attacks occur without any discomfort at all. These silent heart attacks are more common in older adults and women, especially those with pre-existing conditions like high blood pressure or diabetes. Without pain as a trigger, these individuals may only find out they've had a heart attack during a routine checkup, or worse, after experiencing heart failure symptoms. This lack of clear warning makes understanding the subtle signs even more critical. One of the greatest risks isn't just the heart attack itself. It's believing that nothing serious is happening. When seniors don't feel pain, they don't feel urgency. And when they don't feel urgency, they don't act. That delay can be fatal. It's a sobering truth. Relying on classic symptoms may no longer be enough to save a life. Coming up next, the 7 subtle signs that many mistake for just getting older. Why does unusual fatigue matter so much, especially in older adults who are used to slowing down with age? While it's normal to feel a little tired after activity or a bad night's sleep, the kind of fatigue that precedes a heart attack is different, more intense, more persistent, and more confusing. This isn't about needing a nap after lunch. It's about feeling so drained that everyday activities become exhausting. Tasks like folding laundry, walking to the mailbox, or even getting dressed can feel overwhelming. And yet, this isn't typically the type of symptom that sends someone rushing to the hospital. That's what makes it dangerous. Many older adults dismiss this fatigue as aging, not recognizing it as a warning sign that the heart might not be delivering enough oxygen-rich blood to the muscles and brain. When the heart's pumping capacity weakens, cells in the body begin to struggle for energy. The brain interprets this imbalance as tiredness, a quiet red flag that something isn't right. In fact, several studies show that up to 70% of heart attack survivors recalled experiencing extreme unexplained fatigue days or weeks before the event. This silent symptom often goes unrecognized until after the damage is done. Even more concerning, fatigue related to heart trouble doesn't usually go away with rest. It lingers, creating a heavy sense of exhaustion that affects mood, focus, and motivation. For seniors who are already managing arthritis, chronic pain, or medication side effects, it can be especially hard to distinguish this kind of tiredness from other common discomforts. That's why it's crucial to look at the pattern. If someone who was previously active begins to withdraw, sleep more than usual, or complain of having no energy, despite not being sick, it's time to consider the possibility of an underlying cardiac issue, especially when this fatigue is paired with other symptoms like shortness of breath, dizziness, or chest discomfort. Even if those symptoms are mild or irregular, fatigue might not be frightening on its own, but in the context of heart health, it can be a whisper that precedes the storm. A heart working too hard or under threat of blockage will often signal through the simplest means, a body that refuses to feel rested. And in seniors, who may already expect to feel slower, the line between normal aging and dangerous fatigue becomes alarmingly blurry. That's why recognizing this silent symptom could mean the difference between prevention and crisis. Now let's shift to another often misunderstood sign, shortness of breath. Most people associate being out of breath with physical exertion, running, climbing stairs, or working in the garden. But what happens when that breathlessness strikes during rest? Sitting on the couch, talking on the phone, lying in bed. These are the moments when unexplained shortness of breath can signal something far more serious than a respiratory issue. When the heart isn't pumping efficiently, fluid can begin to back up into the lungs. This reduces the lungs' ability to exchange oxygen properly, making even shallow breaths feel strained. In medical terms, this is known as congestive heart failure, and it's often a precursor to or a symptom of a heart attack. But because it doesn't always come with chest pain or dramatic symptoms, seniors frequently chalk it up to aging lungs, a past smoking habit, or even allergies. The subtlety makes it easy to overlook. The nature of this symptom is what makes it so deceptive. It often builds gradually, first noticeable during light exertion, like walking to the bathroom, Then it starts appearing during moments of rest. Seniors might find themselves propping up on extra pillows at night, or waking up gasping for air. These subtle clues are often dismissed as sleep apnea or indigestion. In reality, they can be the body's way of saying the heart is under serious pressure. There's also a psychological factor at play. Many seniors are reluctant to admit they feel short of breath, fearing they'll be told they're just out of shape or overreacting. Others may not want to bother their doctor over something they view as minor. But in cardiology, minor symptoms are never truly minor. Early intervention is critical, and breathlessness, especially when combined with fatigue or swelling in the legs, deserves immediate medical attention. The American Heart Association warns that shortness of breath can be one of the first signs of a heart attack, especially in women and older adults. It's also associated with silent heart attacks, those that occur without the classic chest-clutching moment, but still cause significant, sometimes irreversible damage. Seniors who experience breathlessness during rest, or who notice a sudden change in their ability to breathe easily, should never ignore the shift. Unusual fatigue and shortness of breath might seem like ordinary signs of aging, but beneath that illusion of normalcy can lie a ticking clock. The body rarely lies. It only whispers, and in these cases, those whispers may be the heart's last call for help before the real emergency begins. Coming up next, what sleepless nights, stomach pain, and unexplained restlessness might really mean. Why do sleep patterns suddenly shift in the days leading up to a heart attack? For many older adults, changes in sleep are easily blamed on aging, medications, or stress. But when someone who normally sleeps well begins to have restless nights, wakes up frequently, or experiences vivid dreams and night sweats without explanation, it may not be psychological. It may be physiological. In the days before a cardiac event, the body can become agitated in ways that aren't immediately obvious. The heart, struggling under the pressure of narrowed arteries or reduced oxygen delivery, triggers a response in the nervous system. Stress hormones, like cortisol, surge. The balance between the parasympathetic, resting, and sympathetic, alert systems shifts dramatically, leading to difficulty falling asleep, staying asleep, or achieving deep rest. Some people report waking up at odd hours with racing thoughts, a pounding heart, or unexplained sweating. Others describe an eerie feeling that something is wrong, even if they can't identify any symptoms. This sensation is often the body's last-ditch attempt to grab attention, to flag that a major internal disruption is coming. Unfortunately, many seniors dismiss it as anxiety, bad dreams, or simply part of aging. But when these sleep disturbances appear suddenly, become more intense, or are paired with other symptoms like fatigue or chest tightness, they deserve serious attention. Medical researchers have long studied the connection between cardiac dysfunction and poor sleep. One key insight is that reduced oxygenation during early heart trouble subtly alters brain activity, particularly in areas responsible for regulating sleep cycles. This can lead to insomnia, fragmented rest, or vivid and disturbing dreams. Some studies even suggest that certain kinds of dream content, particularly those involving fear, falling, or suffocation, may be neurological reflections of decreased oxygen flow or heightened stress signals. Though not every night of poor sleep is a warning, a noticeable and unexplained shift in sleep patterns, especially in seniors with cardiovascular risk factors, could be the body's way of ringing the alarm bell quietly, one restless night at a time. What happens when heart attack pain shows up somewhere other than the chest? This is where diagnosis often gets missed. Pain in the neck, jaw, back, or stomach, especially in older adults, is one of the most commonly overlooked symptoms of a heart attack. People expect chest pain, they do not expect a dull ache in the upper back, a tight jaw, or discomfort that mimics indigestion. That's why this symptom is especially dangerous. It doesn't feel like a heart problem, so people don't treat it like one. In women and older adults, heart attack pain is often described as radiating rather than localized. Instead of a sharp, stabbing pain in the chest, They may feel a tightness in the throat, heaviness in the shoulders, or a squeezing sensation under the ribs. These sensations are sometimes intermittent, coming and going over hours or days. Others feel what they describe as strange pressure, pinching, or heat in non-chest areas. Unfortunately, these symptoms overlap with many benign conditions, like arthritis, acid reflux, or even gas. That overlap is what makes this warning sign so risky. When someone feels neck pain, they reach for a heating pad. When they feel indigestion, they reach for antacids. Meanwhile, the heart may be quietly deteriorating. This misinterpretation often leads to dangerous delays in seeking treatment. By the time chest discomfort appears, if it ever does, the window for early intervention may have closed. The key is not to expect heart pain to follow textbook descriptions. The body's pain signals can be misleading, especially in seniors whose nerve sensitivity may be reduced or whose pain thresholds have changed due to age or medication. That's why any upper body pain that appears suddenly, feels unfamiliar, or behaves unusually should be treated with caution. Even if it turns out to be unrelated, it's always safer to rule out a cardiac cause than to assume it's something harmless. In heart health, second-guessing discomfort is a gamble that costs far too many lives each year. Coming up next, nausea, anxiety, and cold sweats, when minor symptoms are anything but. Is that heartburn, or is it something more serious? Many seniors experience nausea, bloating, or indigestion, and assume it's related to diet, acid reflux, or medications. However, in many SEGs, gastrointestinal symptoms are the early signs of a heart attack. What makes it so misleading is that the stomach and the heart share overlapping nerve pathways. This means the brain can misinterpret cardiac distress as a stomach problem, especially in older adults, where pain perception is often dulled or altered. The result: symptoms like nausea, stomach cramping, loss of appetite, or even vomiting may be dismissed as food poisoning or an upset stomach. Heart-related nausea tends to appear suddenly, often without any obvious trigger like spoiled food or overeating. It may come with a vague feeling of unease or fatigue, and can sometimes worsen when lying down. In women and seniors, this sign is particularly common and often misattributed. Some people even describe a burning sensation in the upper abdomen that mimics reflux or ulcers. Unfortunately, treating these symptoms as gastrointestinal problems can delay life-saving care. A study from the National Institutes of Health found that up to 30% of heart attack patients initially presented with only digestive symptoms, no chest pain at all. That's why it's critical to pay attention to the context. When nausea or indigestion is accompanied by fatigue, breathlessness, or cold sweat, the heart, not the stomach, may be to blame. And for older adults, who often have slower digestion and more GI sensitivity from medications, the danger of misdiagnosing these symptoms is even greater. If the discomfort is sudden, unfamiliar, or persistent despite antacids or rest, it's not worth ignoring. The stomach might just be echoing the distress signals of a heart in trouble. Now consider this. What if anxiety isn't just in the mind, but in the heart? Many seniors experience sudden restlessness, nervousness, or even a sense of doom before a heart attack. These emotional states are often brushed off as stress, panic attacks, or old habits. But when anxiety appears out of nowhere, without a clear trigger or history of anxiety disorders, it could be the heart's early warning system in action. The human body is deeply connected through the autonomic nervous system. When the heart begins to struggle, the brain and body interpret it as a threat. This triggers the release of adrenaline and other stress hormones, leading to physical symptoms like rapid heartbeat, trembling, shallow breathing, or a sense of fear. It's a survival response, but in the context of cardiac distress, it's not protecting the body, it's alerting it. What makes this especially dangerous for seniors is that they often don't associate these emotional sensations with heart problems. Anxiety is seen as a mental health issue, not a cardiovascular one. But in emergency rooms across the country, Countless heart attack patients report having felt something bad was coming, or felt off hours or days before the actual event. For women, these episodes of unease and restlessness are even more likely to occur without the typical chest pain, and sadly, because they're dismissed as emotional overreaction, they rarely lead to prompt medical care. What's more, many seniors may avoid talking about these feelings altogether, fearing they'll be seen as overly sensitive or dramatic. But ignoring the emotional cues of the body is a costly mistake. A sudden spike in anxiety, especially when paired with physical symptoms like fatigue, shortness of breath, or dizziness, can be a major red flag. It's not about panicking, it's about noticing when anxiety feels different, unfamiliar, or out of sync with usual stress patterns. In these cases, listening to intuition might just save a life. And finally, let's talk about the sign that often appears last, but hits hardest: cold sweats and dizziness. These symptoms strike quickly and can feel alarming, especially for older adults who already deal with balance issues or blood pressure fluctuations. A cold sweat breaking out in clammy, moist perspiration without heat or exertion is the body's distress flare. It's a clear sign that something is seriously wrong, and in cardiac cases, it often means the body is struggling to maintain blood flow. Dizziness and lightheadedness are equally critical. They occur when the brain isn't receiving enough oxygen due to reduced blood circulation, often caused by a failing heart. For seniors who may already be on blood pressure medication or suffer from inner ear problems, this symptom is dangerously easy to ignore. A sudden spell of dizziness may be chalked up to standing too quickly or dehydration, but when that dizziness is severe with nausea, sweating, or weakness, it should be treated as a potential emergency. What makes this combination so dangerous is its timing. Cold sweats and dizziness often emerge just before or during the actual heart attack. They're not always part of the warning phase. They're part of the event itself, and if ignored, they can quickly spiral into full cardiac arrest. That's why recognizing them, acting fast, and getting emergency help is essential. In conclusion, heart attacks don't always follow the rules. Especially in seniors, unusual fatigue, breathlessness, poor sleep, strange pains, stomach upset, unexplained anxiety, and cold sweats may seem unrelated, but together they can be the body's silent scream for help. Coming up next, what makes these symptoms so easy to miss, and how to stop ignoring what could save a life. What if the real danger isn't what seniors feel, but what they've stopped noticing? Heart disease rarely arrives unannounced. It builds over time, silently stacking the odds through small, often overlooked risk factors. For many older adults, the most dangerous part of a heart attack isn't the event itself, but the years of quiet warning signs that went unrecognized. Take high blood pressure, for example. It's been called the silent killer for a reason. Most people with elevated blood pressure feel completely fine until one day they aren't. In seniors, blood vessels stiffen naturally with age, and the body adjusts so subtly that warning signs like lightheadedness, headaches, or fatigue may seem unrelated. Over time, unchecked hypertension damages the arterial walls, making them more prone to plaque buildup and rupture. Then there's high cholesterol. A few decades ago, it was rarely tested unless a patient showed symptoms. Today, we know that cholesterol can be quietly clogging arteries for years, sometimes decades before a problem surfaces. Seniors often chalk up fatigue or slower recovery after activity to aging. But in reality, their heart might be working twice as hard to push blood through narrowed passages. Diabetes adds another invisible layer. High blood sugar gradually damages blood vessels and nerves, making it harder for the body to register pain signals, especially those from the heart. That's why many older adults with diabetes suffer what's known as a silent heart attack, where no chest pain occurs at all. Instead, they may feel slightly off, nauseous, or weak, and dismiss it. Add to that the creeping threat of obesity and sedentary living. A lifetime of low activity or poor nutrition doesn't just catch up. It compounds visceral fat, the deep belly fat that's hard to see, releases inflammatory chemicals that increase cardiovascular risk. Yet because weight gain in seniors is often gradual, it's easy to overlook. Even loneliness plays a role. Seniors who live alone or feel isolated have a significantly higher risk of heart attack. Social disconnection elevates cortisol levels, disrupts sleep, and encourages unhealthy habits, all of which silently erode heart health. And yet, feeling lonely isn't usually seen as a medical emergency. All these factors work like threads in a web, slowly tightening. Separately, each might not raise alarm, but together, they create the perfect storm. And because the symptoms are subtle or dismissed as just getting older, they slip under the radar. That's why prevention in older adults is less about waiting for big warning signs and more about spotting the slow, creeping ones before they do damage. Coming up next, what makes these silent signs so hard to recognize? And how can seniors stop missing them? When a heart attack strikes, the first 60 minutes, known as the golden hour, can mean the difference between life and irreversible damage. This window is critical because immediate treatment can restore blood flow, minimize heart muscle loss, and greatly increase the chance of survival. But despite its importance, many seniors hesitate, hoping the symptoms will pass or misinterpreting them as less serious issues like indigestion or fatigue. That delay can cost everything. The most vital action is also the simplest. Call 911. Emergency responders are trained to begin life-saving treatment en route and ensure the hospital is ready upon arrival. Time is muscle, and minutes matter. Never attempt to drive yourself or wait until someone else is available. In many cases, patients who delay transportation arrive too late for critical procedures like angioplasty or clot-dissolving medications to be effective. And while it might feel natural to reach for aspirin, only take it if a healthcare professional instructs you to. It can complicate other medications or conditions, especially in seniors on multiple prescriptions. What truly saves time in the golden hour is preparation. Seniors should keep a printed and digital emergency plan, accessible to family and caregivers. This should include a list of current medications, allergies, primary care physician and cardiologist contacts, medical history summaries, and the closest emergency hospitals with cardiac facilities. Many smartphones allow emergency medical IDs to be stored and accessed without unlocking the phone. This feature could make all the difference in critical moments. For those with a known risk of heart disease, reviewing this plan regularly with loved ones is essential. A sudden event is not the moment to start looking for insurance cards or trying to remember which hospital has cardiology services. Knowing the route, having emergency contacts pre-programmed, and informing neighbors or caregivers can cut delays dramatically. The golden hour is not just a concept, it's a countdown. Once the heart muscle begins to die, there is no reversing the damage. Every second counts, and every hesitation could be irreversible. When it comes to protecting heart health, small habits done consistently often make the biggest difference, especially for seniors. Daily choices have a powerful impact, not just in preventing heart attacks, but in maintaining energy, independence, and peace of mind. The truth is, many of the habits that strengthen the heart are simple, free, and within reach. Starting today, begin with gentle daily movement. Whether it's a slow walk around the block, gardening, or stretching by the window, light physical activity helps improve circulation, lower blood pressure, and keep the heart muscle active without strain. It's not about running marathons. It's about moving with intention. Then take a closer look at what's on the plate. A heart-friendly diet isn't complicated. Less salt, fewer processed fats, more colorful fruits and vegetables. Swapping heavy fried meals for grilled options and reducing sugary drinks can gradually lower cholesterol and stabilize blood sugar. Even modest changes over time can reduce the risk of cardiac events dramatically. Sleep, often overlooked, plays a hidden role in heart health. Seniors who sleep 7 to 8 hours consistently have better blood pressure regulation, healthier metabolism, and stronger immune response. Avoiding late-night screens and creating a calming bedtime routine can help the body rest and heal more effectively. Staying socially connected is just as crucial. Regular conversation with friends, neighbors, or family doesn't just lift spirits, it lowers stress hormones, improves mood, and supports cognitive health. Isolation, on the other hand, increases inflammation and heart strain. Lastly, make heart checkups routine. Seeing a cardiologist or primary care provider once or twice a year can catch silent issues before they become serious. These visits help monitor blood pressure, cholesterol, and heart rhythm, and provide a chance to adjust medications or habits early. Knowing is good. Acting is better. Sharing may save someone's life. Thank you for watching this far. If this video helped you understand your heart better, please hit the like button, subscribe to our channel, and turn on notifications. Let's keep each other informed, active, and heart healthy, one choice at a time.